Did you know that lying on your back too much can change the shape of your skull? Brachycephaly is a deformity of the skull which results in a shorter, wider skull, often with a flattened base. Brachycephaly can be categorized as positional or synesthetic depending on the cause of the brachycephaly. So let's dive into those two conditions now. An infant skull is very malleable. This is because its cranial sutures are not fully fused and it still has fontanelles. When the baby is laying on its back, if it's laying on the back of the skull for too long, it's going to flatten the back of the skull, causing it to become shorter and wider overall. So because that brachycephaly is caused by the way in which the baby is laying, it's referred to as positional brachycephaly. The second kind of brachycephaly is referred to as synesthetic. This is when the coronal suture bilaterally fuses prematurely. To help visualize this feature, we just got this skull in the Bone Museum, which has some features consistent with brachycephaly. However, we haven't confirmed whether or not it's a true instance of brachycephaly, but it's a good visual aid. From the frontal view, you can see that the skull is wider than usual. From the superior view, you can see this widening even more, and that it's shorter in the anterior-posterior direction. Although from the lateral view, we don't have as much flattening at the back of the head, which we would expect to see in a positional brachycephaly case, which this one would be as its coronal sutures are not fused. Sometimes it's hard to visualize these without comparing it to a normal skull. On the right, we have a normal skull. Notice that it's not as wide as our skull on the left. We can observe this difference in width from the frontal view as well. Positional brachycephaly is very common, affecting about 1 in 5 babies born in the US. However, brachycephaly is very rare. Craniosynostosis in general only affects about 1 in 2,000 babies, and brachycephaly is only one kind of craniosynostosis. The Bone Museum currently has an exhibit on craniosynostosis. In addition to brachycephaly, we have scaphocephaly, plagiocephaly, and oxycephaly. Oxycephaly is when you have multiple sutures prematurely fusing. Scaphocephaly is when the sagittal suture fuses prematurely. Plagiocephaly is similar to brachycephaly, except it is a unilateral flattening of the head. So craniosynostosis is an umbrella term for when the sutures fuse prematurely. If you want to see any of these specimens, come down to the Bone Museum in Brooklyn, New York to see them for yourself.